What's going on? Welcome, welcome, welcome. If you can hear me, let me know. Start asking some questions in the comments, and I'll do my best to answer it. I'm gonna give it about 2 more minutes, and then I'll give my spiel and be out of the way. And hope you guys have a good morning or whatever time it is, wherever you guys are at. Ukraine is in the building. What's going on? How you guys doing? My name is Dr. Isang. I'm a cardiologist using this platform to be able to answer things regarding the heart, health, and prevention. So just given this opportunity to have you guys ask your questions about the heart. Let's go. You will make it. I appreciate it. The person with the name Via Shah. The question that you're asking is out of the frame of the context of this platform. So I'm answering questions regarding the heart, health, and prevention, things regarding the heart. So you may be in the wrong chat for this one. So I apologize about that. So. All right, let's go. So what are the symptoms one would experience prior to having a heart attack? Like, what are some of the telling signs? So my name is Dr. Isang, and I'm a cardiologist. So this is one of the more common things that I see when someone is having chest discomfort, symptoms of a chest pain. Crushing chest pain is going to be one of the biggest things. It sometimes can radiate to the left side of the body, the left arm, sometimes to the left jaw. The pain gets worse whenever you exert yourself. Every time you walk, you have discomfort. Every time you walk, you're getting chest pain. And it gets better whenever you're resting. And when you're having that, and especially if the pain is getting worse and worse and worse over time, definitely go and get seen by the hospital. Get a lab work done, and sometimes you can get a blood work done. And if it's abnormal, then we proceed with a cardiac catheterization to look for blockage. If there's blockage, then we open it up with a stent. If there's a lot of blockages, then we have to consider open heart surgery. So usually it's chest pain, gets worse with rest, gets worse with exertion, gets better with rest. Sometimes people can have nausea, vomiting. Sometimes people can have shortness of breath, sweating. So a lot of times some people can even have no symptoms at all. So it can fluctuate for each individual. But the classical symptoms are chest pain that gets better with exertion whenever you're stressed, and it gets better with rest. Who are you and what are you doing? My name is Dr. Isang, and I'm a cardiologist, and I use this platform to be able to answer questions regarding the heart, health, and prevention. Welcome to other people who just came in. VVSCY, you are welcome. Any other questions? You guys leave it in the comments. So, when someone is having a heart attack, there are other things that can lead to them having a heart attack. These are the risk factors for heart disease itself. So, things like heart attacks, heart failure, strokes, blockage in the arteries in the legs. So, these risk factors includes high blood pressure, high cholesterol, diabetes, strong family history, especially smoking, and not following up with your medical provider. So, some of the ways that you can treat to potentially prevent a heart attack from happening in the future is by looking at these risk factors. If you have high blood pressure, get your blood pressure checked. High cholesterol, diabetes, get it checked. Most importantly, go and be seen by your medical provider at least once a year to get all these things checked to make sure that you're not at risk for you're not at risk of having heart disease. So when someone is having, chest pain and they're not sure what they is causing this chest pain, so number one, go into the hospital as soon as possible. What do? We get an EKG to look for SC elevations, which are changes associated with having a heart attack. Other things can include having an echocardiogram. This looks at how well the heart is squeezing, looks at the heart valves, looks to see if there's anything, any fluid around the heart. This can be an indirect sign, can show indirect signs of someone having a heart attack. And of course, if you're having the crushing chest pain with the shortness of breath and the lab work that's concerning cardiac catheterization to look for blockages. Sometimes people's chest pain have improves by the time they come to the hospital, so we can also do a stress test, and that also helps us to rule out if you're having significant blockage. A lot of times people will have all these tests done and it's still negative, so what do we do next? We look for other potential causes of chest pain. This can include things with pancreatitis, inflammation of the pancreas. It can be cholecystitis, inflammation of the gallbladder. It can be GERD or reflux. It can be costochondritis, which is inflammation of the chest wall cartilage. So there's a lot of other things that can potentially cause this chest discomfort. One of the things I've also seen too, that is people who have this workup and everything is negative, a lot of them end up having things like sleep apnea. So we always want to make sure that that's being treated appropriately also too. Just cough if you're having chest pain. Not necessarily. Chest pain can be a lot of different things. Could it be asthma? Potentially, but coughing is not going to be the all-time treatment for chest pain. I appreciate that. Let's go. Step one. I remember those days, so good luck with it. The biggest thing is doing as many questions as possible, and probably having some sort of system. I had I had the U World. Is it U World? No, I had the first aid book, so I transferred all of my questions, all of my thoughts into that book. Put a bunch of written notes on it, and just went over it over and over and over. For those of you guys, for those of you guys coming in, this is Dr. A saying answering questions regarding the heart. So, if you guys have any questions, just leave it in the comments, and I'll do my best to answer it. I think there's one here. Callie, the service booch, what is going on? I hope you're doing well. If you're just joining in, this is Dr. Ethan answering questions about the heart, health, and prevention. So, what questions do you have? I'm in near constant silent tachycardia. I had an echocardiogram and other tests done. All were normal. Anything I can do to bring down the heart rate? I don't drink caffeine. So, just with everything that I'm hearing and everything has been normal, especially if you've had a heart monitor to see what the fluctuations are, and if your heart rate is consistently sinus tachycardia or above 100, this may mean you have something called inappropriate sinus tachycardia. A lot of different ways that you can treat it. Most of my patients are on a medication called beta blockers to help decrease the heart rate. There are other medical therapies, but they're very expensive, and a lot of times insurance doesn't cover. One of the things that I have patients do, at least for the first week, is when things are really bad. During the days that are really bad, to kind of have like a journal to see what made that day bad. Was it a certain food that they ate? Was it dehydration? Were they not drinking enough water? Just to see if there's anything that you can change in lifestyle to help accommodate the heart rate. A lot of times, despite all of this, people need to be on medical therapies for the inappropriate sinus tachycardia. I am happy to say that most of my patients that get diagnosed with that eventually are weaned off the medication as their heart rate does get better, stabilizes under 100. But I do have a few of them that are in their 40s and 50s and are on a low dose beta blocker to kind of help keep that heart rate under 100. How to care of heart at home: exercising 30 to 50 minutes a day, 3 to 5 days a week, being consistent, watching your salt content, watching the amount of processed foods that you're eating, and exercising, getting 6 to 8 hours of sleep, following up with your medical provider to make sure you don't have any underlying issues such as electrolyte issues with potassium and magnesium that if you replace can significantly help with your symptoms that you're having. You're welcome. You guys are both welcome. And one of the last topics that I'm going to talk about is high blood pressure and natural ways that you can treat it. The people who need a little bit more care and just a progression of it. So why blood pressure is extremely important, especially in the world of cardiology, is people have no symptoms with it typically. Some people can have elevated blood pressures in the 180s, 190s, and they can have nausea, headaches, and lightheadedness. But for the majority of people, they don't have any symptoms. So it's one of the reasons why it's known as a silent killer. By the time you start having symptoms, it's been progressing for a long time. A lot of people will go to the hospital with high blood pressure and they get diagnosed with a heart attack, heart failure, stroke, and people are wondering, I've been healthy my whole life. What could have caused this? In reality, they haven't been healthy. They've been having issues with high blood pressure for many years, possibly even up to decades. So what constitutes as high blood pressure? Ideal blood pressure should be less than 120 over 80. Anything above that is elevated blood pressure, high blood pressure. Greater than 130, stage 1, greater than 140, stage 2. So it's not fair when I see someone with high blood pressure because they probably have other cardiac issues, but when you typically go and see someone with high blood pressure, they want to make sure that it's truly high blood pressure. So probably checking it again, checking it a couple of different times to make sure that you don't have white coat hypertension where your blood pressure is elevated in the hospital, in the office, and then it's normal at home. If it's not white coat hypertension, then we'll look at natural ways to treat your blood pressure: exercise 30 to 50 minutes, being consistent. Salt is probably going to be one of the biggest things that you can do to help with your blood pressure, to bring it down. So monitoring how much salt you're intaking, how much processed foods, how much canned foods. All of them are packed with high salt content. And weight loss, if you can lose significant amounts of weight, can also decrease your blood pressure. So a combination of weight loss, watching what you're eating, watching how much salt you're taking in, can significantly decrease your blood pressure without having to be on medications. Checking your labs to make sure that your potassium and magnesium are well controlled, because supplementing that can also help with your blood pressure, especially magnesium. So after someone has done all those lifestyle changes with salt, magnesium, exercise, weight loss, and you're still having high blood pressure, then we may need to look at medications. But usually at that time, I start to look at other risk factors for it. I start to look for secondary causes of high blood pressure, things like sleep apnea, issues with your thyroid, perimenopausal people, increased stress can cause it. So if you treat those underlying issues, you could potentially not be on medication for it. But after ruling that out and lifestyle changes and it's still not well controlled, then when you look at medications to help control the blood pressure better. Is 120/80 considered high, doc? No, that's perfect. That's where you want it to be. 5'11", 260. We've got some work to do with the weight, because now you may feel good, but over time, 60s, 70s, your body's just not going to be able to hold on to that weight. Whenever I see someone, no matter how they feel, I see if they can lose 10% of their weight. So for you, it would be 26 pounds. And then from there, you get a little bit more motivation to continue to lose the weight. Nowadays, because it's easier said than done to lose weight, I do look at the medications to help with it: Zepbound, tirzepatide, or Mounjaro. But also looking, once people are on that, to see if they're tolerating it well, because they work well, but they also have side effects too associated with it. 30 years old and have been smoking for the last 4 years. I do very little exercise. I want to keep my heart healthy. Biggest thing that you can do is stop smoking, because nothing may happen to you now, 30s, 40s, but 50s, 60s, you're looking at increased risk of COPD, increased risk of lung cancer and emphysema. And those patients, the one thing they always tell me is that I wish I never started smoking. Easier said than done to quit, but a lot of my patients quit smoking cold turkey once they've had their heart attack. Don't have a heart attack to be the reason why you quit smoking. Let's go, Raj. Started on TRT. So yeah, just monitor how you feel. One of the biggest things people have is issues with their GI system, whether it's nausea, vomiting, GI upset. Just monitor it closely and stay in close contact with your medical provider. You as well get a day started and just win. And winning means just being 1% better. So we can all do that. We can all achieve that. So hope you have a good day. And thank you for joining the live. All right, I'm gonna be on for about 5 more minutes. If anybody has any questions regarding their heart and regarding your health, leave it in the comments. I can be on for about 2 more minutes. So if you have any questions regarding their heart, let me know and I'll do my best to answer it. If not, you guys have a blessed day. All right, thank you guys for joining in. I'll be back later, probably tomorrow around the same time, 6 to 6:30, answering questions regarding the heart. One more person just popped in, so I'm gonna give this person about 30 seconds to see if they have any questions regarding their heart or health, and I'll do my best to answer it. If not, you guys take it easy. I'll be back later tomorrow from 6 to 6:30, answering questions about the heart.